This is at the when they had a open house highlighting our clinic plus setups for they could do eye exams and hearing exams and things like that. That's you and Carrie out there. You're all twisted around. Oh, there you are. I see you. Drawing on doing sidewalk chalk and things like that. They had things. Yep, is that your name in it? Chris Waller. Chris has been part of Valley. We used to call it the Valley Children. So they took part in everything that we did, went through our ups and downs. He grew up in our clinic.
One of my first memories of Valley was Dr. Brody. He was a dentist. I was playing t-ball and I think I got hit in the mouth or something like that and had to go get a dental procedure, and he came in. They weren't open on that day, so he came in and really helped me out. Growing up around her and seeing what she does as a nurse, and it's just a sense of, family there. I immediately thought I wanted to go into the medical field, the way they help people and gave back to the community. I didn't really know if I wanted to be a doctor or a nurse, but I thought pharmacy was the way to go. Talk to people and make sure they're getting the correct medications and make sure they're taking everything right just to help their overall well-being. Okay, there was no charge today. Did you have any questions about your medication?
No, that's it.
Okay, all right. Well, you have a good day.
Thank you.
Thank you. I was born and raised here. I live here now, so my heart is in my community.
It's good seeing you again. You take care.
Thank you.
Next one's ready, Dr. Moran.
Nancy and I have worked together for a long time. We're best friends on the, in here as employees, we're good friends.
Rhonda.
Our styles are not the same, but we mesh well together. We get the job done together. I always tell her I'm not going anywhere till she goes. Nancy or I, neither one has a private office. We are hit the ground running, have to get new shoes every few months because we're just like everybody else that works here. I don't consider myself or Nancy any better off or any worse off than any employee that comes to the door in the morning.
When we look at a health center and what makes it so successful, you've got folks who are maybe a nurse and their husband's a coach, or we have a doctor whose wife is the principal of a school. Folks know each other and are neighbors. I think of a Dr. Corey Mitchell, for instance. Corey is a family physician that works in two of our locations in Wayne County, in Steptown and Fort Gay. He is a neighbor to those folks. He coaches teams, whether it be basketball or Little League, so he not only is taking care of them, but he is a neighbor of ours too.
All right, balls in the bucket, come around, everybody take a knee. Remember, what can we control? Attitude and effort, right? Attitude and effort. Hey, let's bring it in right here real quick.
1, 2, 3, and go!
My favorite thing about Dr. Mitchell is he makes house calls. Who does that? He does. Like, he has patients that are bedridden or otherwise handicapped and not able to come to the office, and he will make house calls.
Hello. How are you? I'm good. How are you? Good to see you. You too. Got Julie with me today. Hi, bud. How are you doing? It's good to see you. I always come back to the term relationship.
I think that is what is key, the relationship and the service. I want to be in service to those. I genuinely care about taking care of people and doing it from a standpoint that I'm part of their community, right? I'm part of, it's almost a family aspect, right? So not only are we taking care of them on a Monday in the office or on a Friday doing a home visit, but then I'm coaching their kid in Little League Baseball. I feel like I am actually living out what my calling is in life. Appalachia is unique, even compared to other places in the country. And we're talking about communities that without fairly qualified health centers likely would have very limited or no access to health care.
You know, it was to go from Harts to Huntington was, you know, an hour drive on a curvy 2-lane road. Fort Gay was the same way. That's really how it all started, because it really was, those areas were really inaccessible.
Can you imagine needing baby formula and, you know, not being able to get it, and, you know, not having transportation maybe to get to Huntington or Wayne or one of the other sites? It's like the old adage, build it and they will come. It was so needed in this community.
So Valley Health came into existence at the very early stages of the Community Health Center movement in 1975. That makes this year, 2025, our 50th anniversary. And given that health centers were only really written into federal law, that the funding mechanism for community health centers came about in 1975. And so for Valley to be celebrating 50 years now, you know, means that we emerged at the very dawn of the community health center movement.
You know, we are presently in Wayne, Barboursville, and Milton, and have plans to open up similar primary care centers staffed by physicians. Our efforts here are to provide economy and management services, to recruit physicians, and to develop other programs that will help keep doctors in our area, attract doctors to our area, and keep the patient satisfied and healthy.
What we hope to do and what we will do through our project is to use community groups who will present their problems and their health problems, which meets their community's needs.
The health centers that were here originally in 1976 were Wayne and Milton and Barboursville. We started in Milton with a small strip mall across the road from where we are currently. From that, we continued to grow and develop.
The early history of Valley Health, the early story, is a story of trailers moving, finding a way to create from almost nothing a structure that's community-based and community-driven, with leadership at the local community level, with a board that's predominantly made up of patients and community members who kind of made it for themselves because the access otherwise wasn't really there.
We got to the point where we were growing so much, we are growing our facilities, and really we had a lot of problems with the trailers. I think our first new building we got was the Fort Gay building, and it was quite a celebration when we did. We went from 2 trailers to a 10,000 square foot new facility. That's really, in my mind, or in my heart, that's what inspired Valley. That's what brought Valley to life, is the fact that there was such a need and we were willing to go into the rural areas where healthcare providers just never did go.
While we were primary care focused and started out in general practice and dental practice, getting involved in providing access to women's health and WIC services. And with that then comes pediatrics and adolescent health, which also ties into school-based health. Each of those moments stand out as points in time when we took on something new. And then in each of those cases, we can look at where we started and we look at where we are now in 2025, and we see this exponential growth curve.
Every opportunity that there was to think about where's a community that has a need, there was a discussion, and it didn't take long, which is the magic of Valley Health. And I don't know what it is. I call it some kind of magic because, you know, you would think, okay, well, do we have the funds or the ability to get something started? We would always find a way. And it wasn't driven out of a business. It was driven out of service. And that's the heart of a community health center, is being in those communities so that you can improve lives. When you look at that, you think, oh, there's always someplace else to go, always someplace else to serve.
Hello, how are you?
Hi.
We're gonna check your vision, see if we can get your eyes seen a little bit better with a pair of glasses.
Okay.
All right.
I think the mission of Valley Health has always been about taking care of people. Even before we put this mission down on paper, because I was there when we put the original mission on paper, it's always been about taking care of people, regardless of their abilities to pay, to the highest quality.
We'll go pick out some cool glasses. Get some blue ones maybe, because we like that blue. Yeah. All right. Those look great.
I want these ones.
Yeah, that's great.
We are here to provide access to care for all people, regardless of their ability to pay. And that naturally means that we're often going into communities or populations within communities who have access challenges.
Seems like that Valley Health saw the need and tried to meet the need with the answer to what the community actually needed. And we're still doing it today.
There are all kinds of barriers to healthcare, and we don't want to be one of those. We want to make sure that we're breaking down those walls. And so meeting people where they are, coming into their communities so that they don't have to go too far because we're right there at their back door. We are continuing to hear the need and meet the need and show up.
It's been nice too, as we've grown into this space and filled it, we were able to use that other building for other services like optometry and behavioral health. You first pitched this building being built, I thought you'd lost your mind because I didn't think we could possibly fill it up, and here we are.
Oh, it's amazing when you start reflecting back at Grant Medical Center and you think, wow, it was a big deal to get someone dental care or OB care, women's health care, and now we have it all.
When Valley Health chooses to expand services, it is oftentimes because we are getting requests or reports from our providers or our patients that they are unable to access specific types of services. So when we talk about a neighborhood health center or meeting people where they are, we want to bring those services to them.
We live there in the community. We know what the community needs. We're not just coming from somewhere and saying, okay, this is what you need, this is how we're going to do it. No, we're answering a call, but we're answering a call of what the community is asking for. It goes back to the basic thing about listening. And when you go to see your physician, you want to be heard. When you go see your dentist, you want to be heard, not talked to or talked down to.
Hey, Ms. Cost. Hey, how are you today? All right. Good to see you.
It all begins with the relationships. You know, it's easy to see the bigger Valley Health, but they all drill down into the smaller Valley Health.
Good. May I listen to your heart?
Yes.
Okay. Thanks.
That's how we make the decisions for the different service lines or the different locations, or adding a service line that already exists but to a health center that already exists. If people need something, we're going to meet that.
The community health center model really is based on a premise that let the members of those very communities help to determine the solution so that they have a voice You know, they have agency to take care of themselves and their neighbors.
Hey, good morning. How are you? Good to see you.
Raise your hand if you are from or you live in the community that you serve. Yeah, that's incredible, and I think that speaks to how we're able to deliver what we deliver so well. You all know the people that come through your doors every day. You see them at the store, you see them at church. Maybe you're related to them. You know when their family's going through tough times, and you know when there's an opportunity to celebrate something. The very first community health centers developed in the 1970s were called neighborhood health centers. And over 5 decades, that's what Valley Health has done. We've not just been a healthcare provider, we've been neighbors.
The patients found out that Valley Health was here to stay. They became a member of the community. Valley Health is a staple in the community now. When our patients come here, they're on a first-name basis with us. And it's, hi, how are you? You know, how's your granddaughter? How's she doing in college? You know, it's just, they're our friends, they're our neighbors. They're the people that we grew up with. We want them to feel comfortable coming here. We want them to know they're the most important part of our job. They are Valley Health. The patients are Valley Health.
We're committed to communities, and that means that we are there for you. Our heart is with you. Many of our employees live in communities where they work. There's a commitment to the community. Our heart is there.
Community health centers are an anchor in the neighborhood. We are a provider of service for all ages, from birth all the way through end-of-life care.
Wow, look at all those cameras. You gonna smile for them? Are you gonna smile for the camera?
We are going to be seeing those babies before they're born, and then babies when they're born through pediatrics.
Wow, look at all those cameras.
As they grow up in the school-based health centers, through all the sporting events, through all of their firsts. Truly, it's just been family, and no matter how big we've gotten, no matter what health center you go to, it feels like family.
Hey, Jesse. Brings you in today.
You're not just a number, you're part of that family. When you come in, someone's gonna know who you are or know just a little bit of something that makes it special.
Good afternoon, young lady. How are you today?
Good.
I'm Dr. Dan. Dr. Brody, but I call myself Dr. Dan. What's your name?
Addie.
Addie. Pretty name. How's school going, Addie?
Good.
How many people have I served through the years? Gosh, over 40 years. I don't know, a lot is all I can say. There's many people like down Fort Gay that I saw that, like I said, full generation. I saw grandparents, parents, the children, and now their children. Unfortunately, I can't remember everybody, but I'll go to the grocery store, food fair, I go over to Walmart, and so many people will come up to me and say, hey, Dr. Brody, how are you? You know, when you think of Valley Health, and now it's very big, but at the end of the day, it's me. I'm Valley Health. Valley Health is people.
The heart and soul of Valley Health are the people, whether it's the people that are working every day and coming here to serve, or whether it's the patients who come and let us and trust us to serve them. I think that's the golden threads. That's our heart and our soul. That's what makes us want to keep doing it and want to keep giving back.
Everybody at Valley has that one individual patient testimony, how we've been able to make a positive impact on their life.
Bye-bye.
Bye-bye.
When we slow down and we think about those individual patients, that is what keeps us going.
No matter how big valleys become, our mission and our why remains the same. that we can grow to have more than 60 locations, but each location is still just as important to us as it was when we only had 5.
So here's my advice. Okay, this is from the recent retiree who started in 1980 and just finished up in December. And I started out as a nurse. If you put the patients first and you get into that, it'll fuel you for the whole rest of your time.
Yeah.
That's my motherly advice.
Yeah.
Never forget what we're doing. You know, I think the future for Valley Health is continuing to do more of the same, which is, where is there a need? How are we going to fulfill it in different communities? You know, I think of several places that I know that there's grand need in neighborhoods that could use a Milton facility in their neighborhood. And because of that, it's like, okay, well, how are we going to do that?
Whenever we can, we try to bring care to people where they are.
Billy Bob, Billy Bob, Billy Bob, Billy Bob. That's right.
Whether it's through us directly or through a partnership with a specialist group in our service area, if there's a gap there and we can fill it, we will almost always fill it if we're asked to. And I think that our history over 50 years demonstrates that. And I think it's the reason that we've seen the growth that we've seen over these years. The secret recipe for our success to this point has been a boldness and a willingness to take risks and to invest and to try new things, but also keeping our core mission and our why at the heart of what we do. And so we are moving forward with a plan to add cardiology this year for the same reasons. We were approached and it made sense for our patients, and we're trying to do that within the greater context of what our communities across our service area need and how we can provide that access to those patients in the communities where they live.